What comes to mind when you hear the world's most expensive drug? Currently at the forefront of cancer treatment, CAR T-cell therapy costs tens of millions of yen per treatment. Currently at the forefront of cancer treatment, CAR T-cell therapy costs tens of millions of yen per treatment. Sometimes the cost reaches nearly 100 million yen. It is a staggering barrier to care. While its dramatic effects have earned it the nickname "Magic Bullet," the cost limits its reach. Why is it so expensive? To answer that, we must understand the complexity of the craft. Because this treatment is less like a drug and more like the ultimate bespoke craft. The key word is cellular modification within the body. It is a radical proposal. The process will now be completed inside your body. This scenario is becoming a reality. Now let's look at why current therapy is so inconvenient and why the cost is so high. To understand this technology, let's look at the complex process of current CAR T therapy. First, immune cells, or T cells, are extracted from the patient's blood through a specialized procedure. First, immune cells, or T cells, are extracted from the patient's blood through a specialized procedure. These cells are frozen and transported by specialized airplanes to a remote processing plant. At the plant, cancer-detecting radars are attached to the T cells through genetic engineering. The completed cells are returned to the patient. It's like sending cells for a study abroad program. The risk of disease progressing during this waiting period explains the 100 million yen price tag. What if this study abroad became unnecessary? Let's explore the in vivo revolution. Here we introduce the next generation in vivo CAR-T therapy. The mechanism is surprisingly simple. Here, we introduce the next generation in vivo CAR-T therapy. The mechanism is surprisingly simple. Nanoparticles carrying genetic information are injected directly into the patient's blood vessels. These nanoparticles have a navigator that targets and combines only with T cells in the body. When the particles encounter T cells, they immediately transfer their genetic information. This utilizes the technology of the mRNA vaccine that we heard about during the pandemic. In essence, this is a paradigm shift, delivering the blueprint directly to cells within the body. This is the democratization of medicine, making treatment accessible to everyone, everywhere. Costs will dramatically decrease, transforming healthcare into an outpatient injection. Costs will dramatically decrease, transforming healthcare into an outpatient injection. But cancer is just the beginning. Let's look at autoimmune diseases. But cancer is just the beginning. Let's look at autoimmune diseases. The power of this technology extends beyond cancer, suggesting a significant possibility for SLE. It's possible to create CAR-T cells within the body that eliminate only runaway immune cells. If they become available with one injection, it will be a godsend for millions worldwide, transforming incurable diseases into diseases controllable with injections. A true revolution. This technology is poised to rewrite immunology itself. Now for our final conclusions. In 2026, we stand at a major turning point in the history of medicine. Hope is now accessible. From processing outside the body to rebuilding within the body. A shift in healthcare power. This paradigm shift reminds us that we possess the power to fight disease within our own bodies. The latest technology is evolving to awaken your body, the ultimate factory. The day when a single injection changes the landscape of healthcare worldwide is just around the corner. Thank you for exploring the future with me. Risi Zaizian.